Thank you very much for the invitation too, and the chance to speak about the developments of Muslim chaplaincy in Germany. And since I have just 10 minutes, I think, for this huge topic, I would like to start immediately. Well, my input relates to my doctoral thesis, but first I would like to briefly outline the situation of the Muslim community in Germany. And we talk about 5 million Muslims in Germany. The number is only an estimate because, as you all know, Muslims are not registered as Muslims anywhere, so the number can only be estimated. And the most Muslims in Germany have a Turkish background, and the Turkish people came in the 60s and 70s as the so-called guest workers to Germany, and they did physically very hard work. And many of them now have health problems, and of course in many studies you can read about this issue. Of course they also have mental and psychological conflicts. In parallel there are deficits in the psychological care for for people with Muslim background in Germany. In addition to this, the social system generally in the Muslim community has become weaker because of the migration to Europe and the industrial development. Also in countries with a Muslim majority, the family structures have changed. In the past there was much support from the family. As you know, we can call this everyday chaplaincy, but now this is missing in Europe and in industrial countries. With this, the family safety network is getting weaker. So the Muslim community in Europe needs, this is one of the factors why the Muslim community in Europe needs Muslim chaplains. This need was also seen by the government, so this topic was and is on the agenda of the German Islam Conference. As we all know, as we all heard, the term chaplaincy does not exist in theological, so we can find it in the Quran or in the Hadith of the Prophet Muhammad, as we already heard. But if we look what Muslim chaplaincy is, we can find many aspects of it in the Quran, both in the Quran and in the Hadith. So in Muslim communities, in the history, or also in the tradition, there was always an act of everyday chaplaincy. For example, irshad, shura, sabr, tawakkul, or how Muslims see illness or death are part of a concept of Muslim chaplaincy, or hizmat, what we already heard. And it has a long tradition in these communities. So there are theological, but also historical foundations which found applications in the practice in form of social commitment, in the visit of sick or the elderly care in Muslim communities. So I did a research on this topic. First I looked which theological and historical foundations of Muslim chaplaincy are in Muslim communities, in Quran and also in Hadith. Then I looked how it is practiced in Germany, but then I compared it with countries like Denmark, France, Britain, Italy, Canada, Netherlands, Austria, Switzerland, USA, and also Turkey. Turkey was a Muslim majority is interesting because 3 or 4 years ago the Ministry of Religion make a contract with the Ministry of Health to train Muslim chaplaincies, and it's interesting to look how it goes on. So I compared it and looked what Islamic theological country can do with this topic and the field of this Muslim chaplaincy. And as a research methods, I made a field research. I analyzed reports, documents, curricula, and made questionnaires, and finally also talked with experts, Muslim chaplains themselves, who are doing this work in prison, in hospital, emergency, telephone, etc., and trainers and instructors of Muslim chaplaincy. And then we can see that there are many institutions who deal with this topic. When we look at the offerings of Muslim chaplaincy, we see different institutions. First of all, of course, the Islamic associations. They want to establish Muslim chaplaincy in Germany, of course. Institutions like hospitals and prisons are also interested in Muslim chaplaincy because they feel the need, they see the need in their institutions. They have Muslim clients who need chaplaincy. Also church faculties. Very often in the research I could see that Christian chaplains go to mosque communities and ask for Muslim chaplains because they feel that they don't have an effective access to Muslim clients in the hospital or in the prison. So they ask for support and then they realize that there are no Muslim chaplains in the mosque as they know it from the church. And often then the question of the training of Muslim chaplains begins in many of the projects. And also the government, the German government is interested in Muslim chaplaincy, as we saw it on the German Islam conference, but also there are some local authorities, city councils who promote Muslim chaplaincy. The research revealed I could find 119 different Muslim chaplaincy projects, applications in Germany, in different areas, as you can see. We have 44 cities, the numbers are cities, 44 cities with hospital chaplaincy, 17 cities with emergency chaplaincy, 45 with prison chaplaincy, and so on. So there are many chaplaincy applications in Germany. There is no chaplaincy, we talked about the topic, in the military. There is no chaplaincy in the military, but currently it is in the discussions. And last week there was a statement from the Catholic military chaplaincy about this topic. So it is in the discussions to have a Muslim military chaplain, but it is not realized yet. One of the results of the research was, or can be recorded, that there are many good projects in Germany. Yeah, there are good projects, but there is not one uniform concept, no standardization, and no quality controls. And when I, for example, point out one area, the prison chaplaincy, we can see this problem, the topic. In the research, I could see that in most of the prisons, or most of the projects with the label prison chaplaincy, there is no individual talk with the prisoners. There are talk in groups, the chaplain talk in groups, but there is no individual talks in most of them. They don't even have a room in most of the projects or the prison chaplaincies I could analyze in my research. But all you know that the individual talk is very important, extraordinarily important in the chaplaincy. So this is one of the points to point out, to show the main problem. So therefore the main aspect or the main result of my research was that the Muslim chaplaincy must be professionalized, on one hand, to professionalize it, and on the other hand, to institutionalize it. So therefore I will only point out these two fields of my research, and I have got some recommendations for this, I hope. This is a problem we heard before. In other countries it's not different. Nearly all chaplains in the 119 projects I could analyze are doing voluntary work. Nearly all, every. So they are working without getting paid. Some of them get ride costs and like this, but for a professionalization you need full-time chaplains, as we heard. Just like the churches do. I think that's the only way to sustainable Muslim chaplaincy, to have a also the education, curricula and work content must be standardized. That's what all experts who I interviewed for the research say. They want a standard for Muslim chaplaincy. And with that you can have transparent qualification standards and quality controls. The chaplaincy education should be to professionalize it at Islamic theological faculties, who should be supported by institutions accredited for Muslim chaplaincy. Also, Muslim chaplaincy should be an optional subject, I think, in the training of imams, because the imams already have a positive access to the community. So maybe you can use this access for chaplaincy too. The curricula should combine chaplaincy competences, social, psychological, social, 1 minute? Educational and therapeutic elements of Islamic youthfulness, and during this education there should be internship institutions in like hospitals, and many of the current projects I analyzed, this is already happening. There are doing this, there are internships in hospitals often. Due to the missing legal status of the Islam in Germany, the Muslim chaplains don't have pastoral secrecy. But this is important to win the trust of the client, especially in the prison. So this must be given to have a professionalization. It is also important not to use Muslim chaplains without any training. This is, I could observe it in my research very often. People who maybe engage in the mosque or doing work in the mosque are chosen as Muslim chaplains without any training, because there are no chaplains. So you take this one. And I think in a work with human and perhaps with emergency situations, you should not use people without training or qualifications. That's a huge problem. So with the standardization, this problem should be solved too, I think. Another important point is that Muslim chaplains should not be recognized as clerics parallel to the imams. That would be a big problem, a huge problem in the Muslim community. So you have a clearly different these two professionals. And for institutionalization, it is important to promote Muslim chaplains in the population too. But most importantly within the Muslim community, because many Muslim people who don't have to walk with Muslim chaplaincy don't know what it is. Also the name, the label, we heard about it, is in the discussion. So the Muslim associations, I think, have to promote this topic in their institutions, in their communities, in the mosques and so on. For effective work, as my research showed too, it is positive when the chaplaincy providers and the Muslim chaplains themselves cooperate with the state, Muslim associations, churches, institutions, confessional and non-religious chaplains, therapists, and chaplaincy associations. In my opinion, it is also very important to have a legal basis for Muslim chaplaincy. With a legal status, you can ensure quality, standards, and sustainability. And there would be an easier way to involve Muslim chaplaincy in institutions like prison and hospital. In some states in Germany where the legal status of Islam is discussed, there are also talks about the legal status of Muslim chaplaincy. The biggest hurdle, in my opinion, is the financing problem. Most of the educations are financed and provided by foundations and so, or the states, some local authorities, but the work of the Muslim chaplains after the training in the hospital, in prison, is not financed already, as I said before. So in my opinion, the finance should be provided by the federal government, states, local authorities, institutions, hospital, prison, military, and so on, and also by the Muslim associations. Last but not least, an Islamic umbrella organization maybe for welfare should coordinate, organize, standardize the Muslim chaplaincy, and it would be great if it would be really one organization and not many Muslim welfare organizations which operate side by side. And I know that this is not so easy. It's a big challenge. Thank you very much.